And we have team coverage as we continue to new challenges through the pandemic. Deaths in patients younger than 50 are rising, and a key treatment for COVID patients is becoming harder to get. The Tennessee Department of Health is now recommending hospitals reserve their supply of monoclonal antibody treatments for unvaccinated and immunocompromised patients. Our Liam Collins begins our team coverage right now with a report from CHI Memorial. Liam.
Cindy, this treatment is only approved through an FDA emergency use authorization, and federal health officials estimate that about 70% of those orders for those treatments went to just 7 states, including Tennessee, Georgia, and Alabama, leading to a worldwide shortage and a shift of who may be able to get one. A life-saving antibody treatment is in short supply.
Whoever needs it gets it. Right? It doesn't matter where you are. If you're sick and can save your life, you get it.
And now Democrats like House Caucus Chairman Vincent Dixie are calling out how Tennessee is reacting to the shortage.
We're #1 in infection rates. Where our children infection rates are rising at an incredible rate.
Tennessee is among the first states to say it's reserving its supply of monoclonal antibodies for unvaccinated patients and vulnerable vaccinated patients. That includes people 65 and older and pregnant women. It's at the recommendation of the National Institute of Health. In response to the surge in COVID cases, the federal agency says the antibody treatments are becoming severely short-supplied.
For this to work, it has to be given really early.
Dr. Mark Anderson is an infectious disease specialist at CHI Memorial. He says the treatment has been key to keeping COVID patients out of the ER and protecting their already strained healthcare system.
Way better than that is to have your own antibodies there already. And you know how we do that, right? Vaccination.
The treatment injects cloned COVID antibodies into patients who have already tested positive for the virus but have not yet developed severe symptoms. With a severe shortage looming, the federal DHHS instructed states to not order their own treatments and instead wait on deliveries from a federal order, a treatment that Dixie says could turn Tennessee's response to the pandemic upside down.
We need to save lives. This is all it's about. All we need people is who want to do their job. Do your current job.
A spokesperson for Governor Lee's office did not respond to our request for an interview. Anderson says that this treatment has become a popular fallback for people who are not interested in getting the COVID-19 vaccine. He says he often hears people saying that that if they get sick, they'll just get the antibodies. But Cindy, he says that this shortage is another proof that's taking a huge risk, that they may not be able to get one if they need to. Live in Chattanooga, Liam Collins, Channel 3 Eyewitness News.
Thank you, Liam.